In 3, 2, 1, and good evening. This is Dr. Jonathan Flordelis, and we are going to talk about a holistic approach for knee osteoarthritis patients. You can call me Dr. Joff, and right now I'd like you to type in the chat below if you are present, if you can hear me. Just type yes. I just want to know if you can actually hear me, if this stream is going live, loud and clear. Okay, thank you, Maureen, for saying yes. What about the others? How are you doing? Can you hear me? I just want to make sure that I'm getting heard. So thank you, everyone. Again, you can call me Dr. Joff. I'm a hip and knee specialist at the Cebu Orthopedic Institute. We're going to be talking about a holistic approach to knee osteoarthritis. Now, for my disclosures, I'm a speaker for Taisho Pharmaceuticals. Now, before I start my talk, I would like to share a story. Is that okay with everyone? Please type yes if that's okay with you. I'm going to share with you a short story about my personal experience. Oh, thank you, Doc. So, in this picture, you will see two people. They are actually my parents. For those of you who do not know me, my parents are actually doctors. My father is an ortho, and my mother is a rehab doctor. And they treat osteoarthritis patients all the time. But my view has changed that as my parents grow older, they themselves have been feeling pain in their knees. And my mother already had some surgery done. My father also had some injections done on his knee. And it changes here at this point in time from the strong, sturdy parents who actually took care of me when I was small. I now understand that I need to take care of my parents because they are now in pain and they need us to take care of them. So if you have that connection with your parents, I know that you want to take care of them. I know that if you have someone in your family with osteoarthritis, you can feel their pain, just like I have. And you may even see some patients going into your clinic crying. And really, it's something that's happened a lot of times. These patients with knee osteoarthritis come in my clinic crying, and I can't help but feel their pain because they don't know me, but they're here sobbing because they want their knee pain to be gone, and they've been suffering for so long that they don't know what to do. So we have all treated these types of patients, and the first thing that we give are pain relievers. And that is something that I also do. However, I want us to think a little bit differently. I want you to understand that the way we treat our patients should not just be the physical. Please understand that there is a social and psychological aspect to it. When patients are always in pain, don't you feel that they're more irritable? And just imagine someone in your family always in pain, always complaining. Would you listen to all their complaints every day? I'm sure at some point you will feel a little bit tired na. Am I correct? But if they're always complaining, if they're always shouting, if they're always in pain, please type yes if you've had enough and you don't want to listen to them. And that creates a social gap. It creates a psychological gap in these patients. We need to treat this. That's why we have patients. That last patient was crying in my clinic. I had to listen to her. That's the first step. Because what I really taught her were mindfulness techniques. These are really important in reducing knee pain and dysfunction. Before giving the pain relievers, we have to treat the mind. And before I treat the mind, I need to listen to her crying. I need to hear her story. And sometimes these patients start their story, Doc, nung 5 years old ako, nahulog ako sa kalabaw. So, may mga nobela po yung mga pasyente natin at minsan, we need to start listening to these telenovelas, even if they're very long, because we need to show them that we care. Now, what we take in, our diet, is also very important. A lot of doctors will tell their patients that there is no diet for osteoarthritis or rheumatoid arthritis, but more and more research is showing that the effects of low carb or ketogenic diets can actually affect the pain in these patients. The degree of inflammation that food brings inside the body affects your knees, affects your joint. That is why more and more research is going into what is now known as the joint gut axis. There's actually a connection with the food that you eat, the microbiome inside your gut, that means the bacteria inside your tummy and all your joints. So, knowing that there's a connection between your gut and your joints, knowing that food actually increases or decreases your inflammation is something that you may want to understand and share with your patients. And the one thing that I personally forget is telling my patients about weight loss and exercise. Studies are showing that we actually need to tell them because they're very willing to exercise and lose weight just to minimize their pain. And I do forget this. Type in the chat below, type 1 if you also forget, and type 2 if you always tell your patients about weight loss. I just want to know. In the chat below, please message or type because I want to know if you always tell your patients about weight loss. I personally forget. Maybe you don't do it because you feel it's insensitive. Maybe the woke patients will get angry, but we have to tell them. For exercise can improve pain, but over-exercising can increase their pain. So you need to find that sweet spot of just enough exercise to loosen up their joints. Physical therapy is also very important, especially heat and electric stimulation, the TENS. Heat shock protein 70 has also been studied. Heat decreases the discomfort and also has a relaxing and calming effect on the osteoarthritis patients. So aside from giving them heat, you can have a hot stone massage. So you can combine heat with a massage. It has been studied that for the first 8 weeks of the massage, it can give a lot of relief, but beyond 8 weeks, no more. So please tell your patients to take this study with a grain of salt because how you do massage will also affect the patient. If the massage is really hard, it can end up hurting your patients. These recommendations from 2014 are still valid today. These recommendations are from multiple organizations, the EULAR, the ORC, the American College of Rheumatology, and the SEO. They all agree the first line should be paracetamol for our osteoarthritis patients plus a topical NSAID. And we Filipinos love to put liniments, oils, creams all over our body. Just be careful. Make sure it's not expired. Make sure that your hands are clean and your knees are clean before you place this. Because I had patients who've had infections because their knees are sweaty, their hands are dirty, their liniments or gels are expired. So be careful, it can lead to septic arthritis. The next thing after paracetamol and those topical NSAIDs are giving the NSAIDs. If you have a patient with a normal gastrointestinal risk, we can give an NSAID with a proton pump inhibitor. And for those who have increased GI risk, a COX-2 selective may be preferred plus a PPI or proton pump inhibitor. Naproxen sodium is a preferred non-selective NSAID plus a proton pump inhibitor as mentioned by the guidelines in the SEO and the ORC. It is also ranked one of the most effective individual treatments, followed by cortisone, PRP injections, and ibuprofen and celecoxib. This is also our preferred NSAID in patients with increased cardiovascular risk. And a lot of patients with osteoarthritis have already heart problems. This is our preferred medications. We want to avoid diclofenac, avoid ibuprofen. But if your patient has an increased renal problem, we avoid NSAIDs altogether. The next thing that is mentioned in the guidelines is actually the knee injections. There are so many knee injections nowadays. There's even collagen for the knee. But in the guidelines, the steroid injection and the hyaluronic acid injections are most studied. There is also emerging guidelines for PRP, but it's still undergoing those trials. When you have a patient with knee osteoarthritis in the inflammatory stage, hubag kayong knee, di ba? It's really inflamed and swollen. Once we aspirate that, relieving the pressure also relieves the pain. And we give even more pain relief when we put in those medicines, the lidocaine with your steroid or the HA injections. Patients are really happy walking out of the clinic because, of course, they don't want any surgery. But you need to tell these patients, as doctors, that the 6 months to 1 year is not always the same. Meaning, the effects will last for some patients 6 months, others 1 year. But for others, it may not last a whole month because of the degree of osteoarthritis. If the knee osteoarthritis is really severe, it's already bone on bone, then it's very possible that the effects are minimal. And that is why we need to teach the patients, treat them, and explain to them these are options, but it's not a cure. Dili sila maayo. When everything has failed, that's when I advise the patients a knee replacement procedure. Knee replacements are really good once the patient knows what they want. If the patient is really someone who is wanting to travel abroad, wanting to go to the mall, then it's very possible that they will want this. They will want this because they understand the risks. They understand also that this is the thing that can give them their quality of life back. I've had patients, I know patients very old who still want to do sports. Do you know someone with knee problems who still wants to be active in life? Yeah, if you do, please mention yes. If you know those patients who still want to be really active, some of them still living alone, 80 years old, wanting to play tennis or golf, then this is what I tell them. I ask them what they want, and if their desire is really greater than their pain, the knee arthroplasty is a procedure that treats by removing the ends of the diseased bone and replacing it with polyethylene and metal so that the patients will have a new knee and will be able to walk again as early as 24 hours after surgery. They can wait carefully. This is a patient with a knee replacement on both knees. She's actually a sister in a convent who wants to go up and down stairs. After surgery, she's already walking without assistance. And we discharged her, I think, in day 5 post-surgery. Now, I want you to know I have a secret in treating my patients. I really listen to them. History is all about listening to our patients. Like I mentioned, a lot of patients just want to be heard because no one listens to them anymore. That's why they tell their story starting from 5 years old to present. Secondly, to serve powerfully, I really need to do a physical examination and touch the knee of the patient, check their meniscus, check their patella, and this gives them the warmth that they need because a lot of their family members don't want to listen to them and they don't want to touch them anymore because they're very, very irritable. Being present, physically present, listening to these patients, touching these patients means a lot to them. And explaining to them what their labs mean will reassure them that it's not cancer and it's not something that will lead to their demise. Because a lot of these patients are very, very anxious already. And the last thing they want to hear from an orthopedic surgeon is they need surgery. So I hope this helps. Please remember that as doctors, the patients will still forget what we did to them, our treatments, or even surgeries. They forget. They forget our advice, but they will never forget how we made them feel. So I hope this helps everyone listening, and I hope to share more with you in the future. This is Dr. Joff. I think this is the end. Thank you so much for listening. If you are still here, please type 1. I'm sure a lot of you are already asleep. So those who typed 1 are actually present, and our what do you call this attendance list will include you. We're checking attendance. Bye bye. Sige.